Hello friends, welcome to High Target Point. Today we discuss about important MCQs is based on previous 2019 AIIMS exam. In this video, 40 MCQs. This is very helpful for all upcoming nursing exams. Let's start. Question number 1. Who is father of psychoanalytical theory? A. Lawrence Koselberg. B. Jean Piaget. C. Abraham Maslow. D. Sigmund Freud. Correct answer is D. Sigmund Freud is father of psychoanalytical theory. Next question. 2. Twitching of facial muscles when the facial nerve is tapped anterior to the earlobe is called A. Chastic sign. B. Trousseau sign. C. Homan sign. D. Brzezinski sign. Correct answer is A. Chastic sign. Next. 3. Which of the following is used for passive immunization? A. Killed vaccine. B. Human and animal sera. C. Toxoid. D. Live attenuated vaccine. Correct answer is B. Human and animal sera is used for passive immunization. Next question. 4. Management of Wernicke's disease and beriberi involve administration of A. Iodine. B. Vitamin A. C. Vitamin C. D. Thiamine. Correct answer is D. Thiamine is used for management of Wernicke's disease and beriberi. Next. Do not harm is which ethical principle? A. Veracity. B. Beneficence. C. Non-maleficence. D. Justice. Correct answer is C. Non-maleficence. Next question. When toddlers move around on their hand, keeping their abdomen off the floor, it is called A. Skimming. B. Crawling. C. Creeping. D. Rolling. Correct answer is C. Creeping. Next. Eugenesis means A. Improvement of genetic endowment. B. Genetic counseling. C. Improvement of environment. D. Genetic preventive measures. Correct answer is A. Eugenesis means improvement of genetic endowment. Next. Parrot-like repetition of word spoken by another person is known as A. Echolalia. B. Neologism. C. Echopraxia. D. Dyscalculia. Correct answer is A. Echolalia. Parrot-like repetition of word spoken by another known as echolalia. Next. Which of the following immunoglobulins will be high in a person with an allergy? IgE. B. IgG. C. IgM. D. IgA. Correct answer is A. IgE immunoglobulins will be high in a person with an allergy. Next question. If a chest drainage system line is broken or interrupted, the nurse's first action should be to A. Document findings. B. Notify the physician. C. Wait for order. D. Clamp the tube immediately. Correct answer is D. Clamp the tube immediately. If chest drainage system line is broken or interrupted, nurse first action is clamp the tube immediately. Next, which part of the mind is associated with practical reality principle? A. Hyperego. B. Superego. C. Ego. D. Id. Correct answer is C. Ego. Next question. A rare condition in which separate personality exist in the same person is called A. Dissociative identity disorder. B. Delusion. C. Schizophrenia. D. Somatoform disorder. Correct answer is A. Dissociative identity disorder. Next question. Acid-fast bacilli are found positive in which of the following condition? A. TB and leprosy. B. SARS and diphtheria. C. TB. D. Diphtheria. Correct answer is A. tuberculosis, and leprosy. Acid-fast bacilli are found positive in TB and leprosy. Next, which of the following hepatitis virus is spread by fecal-oral route? Hepatitis A, B, hepatitis C, C, hepatitis D, D, hepatitis B. Correct answer is A. Hepatitis A is spread by fecal-oral route. Next, A dash is an elevation of skin filled with fluid and is less than 1 centimeter in diameter. A wheel, B vesicle, C papule, D macule. Correct answer is B vesicle. Vesicle is an elevation of skin filled with fluid and is less than 1 centimeter in diameter. Next, tall tented T-wave and widened QRS are seen in A. Hyperphosphate, B. Hyperkalemia, C. Hyponatremia, D. Hyperglycemia. Correct answer is B. Hyperkalemia. Tall tented T-wave and widened QRS are seen in hyperkalemia. Next, the first action in case of a blood transfusion reaction is A. Waiting for symptom of subside, B. Stopping the blood, C. Informing a physician, D. Maintaining the line with normal saline. Correct answer is B. Stopping the blood. First action in case of blood transfusion reaction is stopping the blood. Next, sharing responsibility and authority with others and holding them accountable for performing is termed as leading, B. Organist, C. Controlling, D. Delegation. Correct answer is D. Delegation. Next, which of the following is considered as an indication for administer serum albumin? A. Formation of WBC, B. Maintenance of oncotic pressure, C. Formation of RBC, D. Clotting of blood. Correct answer is B. Maintenance of oncotic pressure. Next, in ECG, the peep wave represents A. Arterial depolarization, B. Ventricular depolarization, C. Ventricular repolarization, D. Arterial repolarization. Correct answer is A. Arterial depolarization. In ECG, the P wave represents arterial depolarization. Next, the statement of belief and ideas which are considered to be true are known as A. Operational definition, B. Assumption, C. Conceptual definitions, D. Hypothesis. Correct answer is assumption. B is correct answer. Next, hypertonicity and scissoring leg movement are expected clinical finding in A. Autism, B. Cerebral palsy, C. Mental retardation, D. Schizophrenia. Correct answer is B. Cerebral palsy, hypertonicity and scissoring leg movement are expected clinical finding in cerebral palsy. Next, tetracyclic is used as prophylaxis for A. Leptospirosis, B. Brucellosis, C. Cholera, D. Meningitis. Correct answer is A. Leptospirosis. Tetracycline is used as prophylaxis for leptospirosis. Next, on physical examination, the nurse notes that there is separation of layers of surgical wound. She records it as A. Evisceration, B. Herniation, C. Prolapse, D. Dissection. Correct answer is C. Prolapse. Next, the study of culture and practice in different societies is called A. Entomology, B. Paleontology, C. Anthropology, D. Ornithology. Correct answer is C. Anthropology is the study of culture and practice in different societies. Next, all of the following are side effects of rifampicin except A. Dizziness, B. Anorexia, C. Orange color urine, D. Hypertension. Correct answer is D. Hypertension. All are side effects of of rifampicin except hypertension. Next, all of the following viruses are transmitted by respiratory route except A. RSV, B. rotavirus, C. influenza virus, D. rhinovirus. Correct answer is B. rotavirus. All viruses are transmitted by respiratory route except rotavirus. Next, a client complains of bleeding gums. The nurse will advise him to take diet high in A. Vitamin C, B. Vitamin B, C. Vitamin A, D. Vitamin D. Correct answer is A. Vitamin C. If client complains of bleeding germs, the nurse will advise him to take high vitamin C. Next, andragogy referred to A. experimental learning, B. child learning, C. adult learning, D. action learning. Correct answer is C. adult learning. Andrology referred to adult learning. Next, gravida referred to which of the following description? A. number of times a female has been pregnant, B. number of full time a female has delivered, C. number of live children, D. number of preterm pregnancies a female has had. Correct answer is A. number of times a female has been pregnant refer gravida. Next, which of the following is not a function of the sympathetic nervous system? A. increase heart rate, B. rest and digest, C. increase blood pressure, D. fight or flight. Correct answer is B. Rest and digest is not function of sympathetic nervous system. Next, B. false sensory perception with no basis in reality are known as A. delusion, B. illusion, C. hallucination, D. loss association. Correct answer is C. hallucination. False sensory perception with no basis in reality are known hallucination. Next, cystic fibrosis is an example of A. autosomal recessive disorder, B. X-linked dominant disorder, C. autosomal dominant disorder, D. X-linked recessive disorder. Correct answer is A. autosomal recessive disorder. Cystic fibrosis is example of autosomal recessive disorder. Next, isolation of a child with mumps belongs to what level of prevention? A. intermediate, B. primary, C. tertiary, D. secondary. Correct answer is B. primary. Isolation of a child with mumps belongs to primary level of prevention. Next, Kull's fracture is a fracture of the A. distal end of ulna, B. proximal end of radius, C. distal end of radius, D. shaft of humerus. Correct answer is C. distal end of radius. Fracture is Kull's fracture. Next, Bilirubin 1 and Bilirubin 2 surgical procedure done for A. gastric cancer, B. pancreatic cancer, C. breast cancer, D. lung cancer. Correct answer is A. gastric cancer. Bilirubin 1 and Bilirubin 2 surgical procedure done for gastric cancer. Next, ophthalmic medication should be instillated at A. lower conjunctival sac, B. the cornea of eye, C. upper conjunctival sac, D. the edge of the eye. Correct answer is A. lower conjunctival sac. Ophthalmia medication should be instillated at lower conjunctival sac. Next, chloroquine exhibit action A. antifungal, B. antimycotic, C. antimalarial, D. antiviral. Correct answer is C. antimalarial. Chloroquine is antimalarial. Next, serum SCG test is used to diagnose the following condition: A. carcinoma cervix, B. carcinoma vagina, C. carcinoma endometrium, D. choriocarcinoma. Correct answer is D. choriocarcinoma. SCG test is used to diagnose the choriocarcinoma. Friends, thanks for watching. If you like this video, please subscribe my channel and like this video.